times get hard, and we're here to help at NorthPoint.
Hello, welcome to another episode of NorthPoint Making Health Happen. My name is Lisa Castile, your host for the program. Thank you so much for tuning in today. This series is being brought to you by NorthPoint Health and Wellness Center. We want to connect with you about topics in health and wellness that impact our community, and we want to provide you with practical tips and resources you can use. Today, we will be discussing bridging care with our immigrant communities. Joining us is Yesica Gonzalez De Evans, Supervisor of NorthPoint's Interpreter Services team. Yesica's journey began as an interpreter long before she even realized it. She was interpreting for people in her home, at her school, and in her community. During her time here at NorthPoint, she's gained 10 years of experience interpreting and translating for the limited English proficient population in a healthcare setting. Her deep comprehension of medical terminology and human anatomy, along with her extensive experience as an interpreter, make her uniquely positioned to help increase community access to health and wellness resources. Yesica, thank you so much for joining us on the program today.
Thank you, Lisa.
So excited to have you.
I'm excited as well.
Great. Well, why don't we start with you sharing? I shared a little bit, but tell us about your journey and how you came to be here at NorthPoint.
Long story short, because I feel like it feels just like yesterday that I was just here volunteering. So I've had a very deep connection with the community here for a really long time. It's first started off with an organization I was volunteering with when I was a massage therapist. And then through my massage therapy work, where I was also interpreting for patients there, and they were also receiving services from me, I got connected to NorthPoint through another volunteer opportunity. I volunteered for an event that we used to have called See, Test, and Treat, which is the event that we have for pre-mammograms and pap smears. I was interpreting for our pathology team, and a couple of months later, I was offered a position.
Love it. It just fell from the sky.
Yep, it completely did. It was... It was such an incredible opportunity to see the level of impact that NorthPoint was having on the community and how many women we were helping, because it was a day that was completely dedicated to the Latino population, because it was a Spanish-speaking day. And I just fell in love with NorthPoint and all the work that we do here.
And that's what happens, you know, when you encounter NorthPoint. My experience is similar to that. You just want to not leave.
Yep.
So wonderful. Well, let's talk about this. Let's get into it. We know that 40% of our guests receive services in their preferred languages other than English. Can you tell us what some of those languages are that we hear?
Yeah, of course. So about 40% is the biggest portion of it would be Spanish, Hmong, Laotian. Alongside there, we have over 100 different languages that we have served here at NorthPoint, which would include French, Oromo, Somali, Arabic, a lot of African languages, and some Asian ones like Korean, Vietnamese. But the biggest bulk of it would be Spanish, Hmong, and Laotian.
So tell us about your team and what you do.
So currently right now we have an in-house team, which is something different than any other area that, you know, other clinics that they don't have typically an in-house on-site team. We have a Spanish team, a Hmong, Laotian, and Thai team. So our Hmong Laotian interpreters are multilingual, which is amazing, by the way. They speak upwards of 3 languages themselves, and then we have our Spanish team, which is an incredible volume that we have here for Spanish alone here.
Oh my goodness. So how large is the team that you supervise?
So the in-house team is currently about 11 individuals. I have about 3 individuals that are on our Hmong, Laotian, Thai team, and then the other 8 are on our Spanish team.
Okay. And so how does that work when a guest comes into NorthPoint and they are, English is not their first language? What is offered to them?
So typically the first thing they do, obviously they go into register. From our registering team, they try to figure out what is their language need first. Most of the times, most of our LEP population will be able to tell you what country they're from or what language off the bat. From there, if it's a language that we serve in-house, they're able to utilize our services right away. Or if it's a language we don't serve, that's when we use other tools like a video remote interpreter.
Wow. So what are some of the common barriers that immigrant families face when they're seeking healthcare services?
The biggest thing is approaching someone that doesn't speak your language. And that's across the board for anybody, not just, one specific immigrant population.
Okay.
It's coming into an unknown space, seeing if someone does speak their language, if they're able to offer their language, and then to the system. A lot of other immigrant communities have a whole nother understanding of healthcare. Most other countries, their healthcare systems is you go in, you get a service, you're done with that service for the day. Where in this type of healthcare system, they don't typically do that. We have a process. They have to establish care. They have to get, meet their provider, get established and all that, which is not typical in any other country.
Yeah, and that can be very difficult to navigate.
Yep.
Yeah. So would you say, how does cultural sensitivity and awareness play into the care we provide here at NorthPoint?
It's huge. Just because we are able to inform not just our support staff, but our providers too of some culture change differences that might occur because of systematic change, differences, cultural differences. It helps them understand. And then it also helps them connect and bond better with their patients because they're able to give them services while also respecting their cultural differences.
Sure.
The biggest piece that I could tell you is, especially for our Hmong community, there are a lot of shamanism, and it's more herbal. And a lot of our providers understand that and connect with our interpreters, and our interpreters also are part of the community and are able to let them know, hey, this is something new that just came from our country. Just so you know, this is what they might be taking this new tea, for example. And then we're able to inform the providers. The providers are able to inform themselves and be able to have a very educated communication between the two of them of whether or not it's reasonable or if it's okay for them to take that particular tea.
That's amazing.
So if they don't want to take medication and because of religious reasons or cultural reasons, we're able to work with the provider and the patient to make them aware of what the differences are. And so then they can actually explain certain things better to the patient on why this medication actually will function better than you taking a tea.
Okay. Yeah, and that helps build that trust too when you have the background and the knowledge about practices and things that we're doing within their own cultures. Yeah, that's amazing. Okay. Are there some specific strategies that we employ here at NorthPoint to help bridge care gaps? I mean, we talked about that a little bit. But tell me a little bit more about interpreter services and more specifics around that.
So kind of the common thing that we are known for is, we're people say that we're just the talker, we're just there in the room, we're the fly in the wall, right? We're the voice. But we're much more than that. We're the eyes, the ears, the advocate, the everything across the board for the patient because they're not able to communicate fully. The way that I describe it to all the new interpreters is you're also an actor because you also have to play on if the patient is in pain, your expression also needs to change. If you are if the patient is angry or saying certain words, like if the patient ends up saying a really bad word, you are also supposed to interpret it, because you're expressing what you're saying, what they're trying to express.
Sure.
And
Without filtering it.
Without filtering it, exactly. And we also are the individuals that understand different levels of the language. So what I mean by that is, in particular for Spanish. So just because you may have learned Spanish for 6 years in college, you may know one part of Spanish. What I mean by that is, I'm from Mexico, so my Spanish forte is from Mexico. But even though I'm from Mexico, Mexico also has states. So regionally, I may also be regionally based, so I might only have a regional understanding. But as an interpreter, I have to know regionally across the board in Mexico. I have to know Spanish versions from Ecuador, from different parts of Ecuador, and other, Spanish-speaking countries. So that's one of the biggest difference in being an interpreter and a bilingual staff, is that we also know, I can tell you 10 different ways on saying how to do a filling.
Wow.
And we need to keep that in our brain. Versus someone that is just a native speaker may just be able to tell you one.
Sure. That's amazing.
Yeah.
That's quite a skill set that you have there. And
I call it my mini dictionary.
Yes, and then you're not only doing interpretation for guests, but then you interface with our team quite a bit. We do we're responsible for communications here. So talk a little bit about that work. What does that look like?
So the work that we do with communications is more on a translation level. So that is within itself is a whole nother beast.
Yes.
Because that we have to do a target audience that is a level of a language that it's that someone can understand across the board. So it's not just one register, but it's a plain language everybody can understand, and that is huge. Just because sometimes the information needs to come out in a certain way, and the work that we've been doing with communications these past few years has been amazing. I feel like we've impacted a lot on our community. Especially one of my biggest wins, I feel like, are our monitors, our slides, and our maps. When people finally see that they're translated, they're like, oh my God, I didn't know that was translated. When it moves the screen, or the permanent signage that we have in the building. That is actually something that you don't typically see at every clinic, by the way. So we are at the forefront of that.
Yeah, we're at the forefront of a lot of things. And so just for our audience who's listening, we have 21 monitors throughout our clinic that deliver key messages. And so Yesica's team is responsible for making sure that those messages are available in English and other languages for our guests to understand. And they just play all day, every day. You all have quite a big job. So other than the on-site interpretation that you do with the guests, and the translation requests that you get, so many of those, because across all of our departments, is there anything else that your team does that we don't know about?
Yes. One of the biggest things that we do is advocacy, that actually a lot of people really don't see. So typically the LEP population is one of the populations that gets kind of lost in the fathom that is the healthcare system, and we help with that to navigate it. What I mean with that is we work with all the different departments, all the different areas to filter out some of those barriers. So if it's it can be a patient for some reason doesn't have transportation, but by talking to them, we find out, hey, they live here in North Minneapolis. They can take our transportation. It can be something as simple as that, where we communicate our resources, and something as big as a referral where they didn't know that they could go somewhere else.
Okay, sure.
So a lot of that we typically tend to do, a lot of that filtering and a lot of helping eliminate some of those barriers across the board for the community, to make sure that they leave here with the care that they deserve.
So you guys are really embodying that one of our pillars of whole person integrated care, because you are looking at everything, right?
Yep.
My goodness.
Yep.
And so your team, if a guest comes in and they're receiving one service, but they end up going to the food shelf, you stay with them the whole time?
Pretty much, yeah.
Wow.
Yep.
So, okay.
We have a really good system for pre-pandemic, obviously, because our volume significantly increased.
Yeah.
We would actually follow them if they were completely new. So we would actually check in to see if there was anything else additional that they would need, give them the little spiel of, here's all our services. Is there anything else you need before you leave? Or, if there is, let me know, come back. Typically, most of our patients that do come back, there's a key thing that we always tell them. Look for a radio. So the way that we communicate across the campus is through our radio system. So if they see an individual that has a radio attached to them, they know it's an interpreter.
Yeah. And I know from coming over to the clinic that we see your staff it's not like they're down in the office just waiting. I mean, they're out on very visible to guests, in between guests that they're servicing, to say, I'm here to help you.
Yep.
I think that's really amazing. You've got a great team. So I want to transition and talk about, we've had some recent policy changes at a federal level. And it's impacted accessibility, and has it impacted accessibility and the quality of health care for immigrants?
Yes. I would feel like the accessibility is about the same, just because NorthPoint is amazing at trying to eliminate some of those accessibility barriers. It's more the fear now. They're very fearful of coming to their appointments. They're fearful of just, even if they know that NorthPoint is safe, they're fearful of coming here if they're going to get stopped on the way or on the bus or what have you. And that's impacting their health significantly, because they're staying home and not coming to their appointments. That's where NorthPoint is so great, because we're already looking into things that we could do to eliminate some of those barriers by maybe having our providers are already saying, if you can't come, call NorthPoint, tell them you want me to change them to a telephone visit, and we'll do that for you.
That's awesome.
That's where we're trying already to do some of those things, but across the board, we can't reach everyone, because there is going to be some appointments that unfortunately do have to be in person.
Sure.
But that would be the biggest barrier right now that I'm seeing, and the biggest impact is they're questioning whether or not to come in to receive services. And for some of them, it's, they're maintaining a chronic disease and they need to come for their medication or follow-ups. And it's very critical.
And so our team here is really thinking outside the box on how we can support them. And so you've mentioned, some of our providers are offering video visits or what they can, but then recently you made our team aware of a tool, and those are the red cards. Can you talk about like some of the tools like that?
Yeah. So one of the biggest things is people need to know their rights. And even though you may be undocumented, you do have rights, just like everybody else. They're human rights. So the red cards are a tool for them to use if they ever do get stopped by a nice individual. It's for them to know that they have the right to not speak to the individual. They have a right for many other things, because a lot of the community doesn't speak English, and I can never guarantee you that they're going to have an interpreter present, or that the staff is going to be Spanish speaking. So by them handing this card to that ICE agent, it's stating, I'm aware of my rights. I don't need to talk to you. And if I'm not under arrest or you don't have a warrant, I also don't need to open the door.
Good.
So
we're doing a lot of education as well, because I know our CEO, she's very big on educating and taking that back to your family and your community, so that we're having our community be empowered. Not feeling like there's nothing that they can't do, right? They can't. They have rights, and there are things that they can take and be in control of with their health.
Exactly. Yes, and it's been super huge. Our CEO has been super supportive and has has also, made a promise to have these things available, resources and connections. And it's also empowered our staff too, because as some of our providers had already seen, they didn't know what to do. And literally we came up with this and they're like, oh my God, thank you so much. I didn't know this existed. I can tell you that the number of providers that are handing this out and having this one-on-one conversation with them is happening on a day-to-day basis. Every single provider is pretty much having this conversation so that everybody knows their rights and everybody knows that there is something that they can do.
And it's interesting to me because we understand that the cultures that we encounter, a lot of that information they take back, right? So that's what helps build, it takes a while for someone to build up enough trust. They come in, they find out what NorthPoint is about, that it is a supportive environment, and then they take that information back. Like, well, this is what I learned today, that I do have rights, and so let's be encouraged and get here for our appointments. And what would you say to someone listening right now who may have a family member or a friend or know someone who is part of the population? What would your advice be for them?
In terms of
so so from the LEI population, like let's say I know somebody, what would you advise me to say to someone? Because this is a real thing. I have my best girlfriend, her future daughter-in-law, I will call her. She's very young. She's undocumented, and she's, like you're saying, she's terrified to leave the house. But we know that like Minnesota Care has recently expanded eligibility for a certain population. So things like that. What would you say to someone? What would you tell me?
What would I tell you? That you have a choice. You can either live in fear or you can live for yourself. The unfortunate situation that we're currently in, is going to impact us for a few years. We don't know in what capacity, but that doesn't mean that it should affect your health. Minnesota Care is one of the biggest and most amazing thing that Minnesota did this year, and a lot of people are super fearful of even signing up. But it's one of the biggest things that can make or break someone, because medical bills can rack up pretty quickly. So if you have a medical need, don't be fearful. Figure out what is the best way for you. If it means doing a video visit with your provider, if it means doing a telephone encounter with your provider, whatever works for you, because the fear is still real. Reach out. I reach out to mental health services too, just because right now that is the biggest thing that our people are seeing is the need there is going up. So I would say if you have a medical emergency, go. Don't wait. Because it could be detrimental to your health. And don't be fearful, because you do have rights. You do. There is something that you can do, and you have a choice.
Okay, great. Is there anything that we can do as individuals or community members to play in advocating for better health care for our immigrant community?
As a individual who comes from the immigrant community herself, and I'm a first generation Mexican American, I am here legally, in their terms. I am also advocating for those that are not, because I know that if they detain me, it will be a matter of time before am able to come back. For those individuals that are in the same boat as me, speak out for those individuals that cannot, because the more that they infringe on our civil rights, it also prevents them from doing further damage to our immigrant community. So if it means speaking to your congressman, speaking to the legislative, doing the protests, doing the signatures of, of all that stuff, do it. Right now, there's a couple of different organizations that are organizing raids to be individuals to document those situations, because right now they got a green light for a lot of things, and a lot of the protections that we had in the past are not there anymore. So if you're an individual that feels very passionate about this, I would say, let's stick up for the little guy.
Yeah, let's make your voice heard. Okay. Yeah. Wonderful. Is there anything that you would like to share with our listeners that we haven't talked about today, Yesica?
Not really, Lisa.
Okay.
I think we covered quite a bit.
Good.
And just all the amazing work that our team does, and the amount of people that we see on a day-to-day basis is just, it's amazing. And all the lives that we've impacted also. Yeah.
Well, your team is amazing, and you are an amazing leader. We appreciate you so much. So thank you again for being on the program.
Thank you, Lisa.
Keep up the great work that you're doing.
Thank you.
All right. Thank you for listening to this week's Making Health Happen. We want you to know that we're here to partner with you and to help make health happen in your life. To learn more about NorthPoint, call us at 612-543-2500 or visit us on the web at northpointhealth.org.